I'm Allie Carlson, and today I will be covering the Rubella virus. Some background on the Rubella virus includes that it is a spherical structure approximately 40 to 80 nanometers in size. It is single-stranded RNA with a lipoprotein envelope, and it is approximately 3 times 10 to the negative 6th in weight. The Ruby virus falls under the tegovirus family. Under this family, there are 3 major structural polypeptides, 2 of which are membrane glycoproteins and a single non-glucosinated RNA capsid. One envelope protein, which is the E1, is responsible for neutralization and homogenization. Virulence factors are virus-specific polypeptides E1 and E2. The last major epidemic in the United States was from 1964 to 1965. During that time period, 12.5 million people contracted rubella. 11,000 pregnant women lost their child, 2,100 newborns died, and 20,000 babies were born with CRS, or congenital rubella syndrome. Rubella has been eliminated from the United States since 2004 and is no longer considered an epidemic here, but is still very much present in other countries. Humans are the only host or reservoir of the Rubella virus. People who contract the Rubella virus are infectious from about 1 week prior to a rash until 1 week after the rash has dissipated. Peak infection times include late winter to early spring. Rubella is spread through direct and indirect contact. Direct includes mucous membranes and placental transmittance. Indirect includes respiratory droplets that occur during coughing, sneezing, or speaking. Some signs and symptoms of the Rubella virus include a low-grade fever, sore throat, red blotches that start on the face, turn into a rash, and move quickly to the abdomen. 25 to 50% of people who contract the Rubella virus do not get a rash. These people only show flu-like symptoms, and it is very hard to pinpoint the illness without blood testing. The Rubella virus multiplies in respiratory cells, then becomes viremic, where it can spread and target organs. T-cell immunity can play an important role in the recovery process. Some complications with the virus include 70% of women who get the Rubella virus could also develop arthritis. This arthritis will dissipate as soon as the virus leaves the host's body. Congenital rubella syndrome, miscarriages, heart problems, and liver and spleen damages. CRS, or congenital rubella syndrome, is when the mother contracts rubella and spreads it transplacentally to her fetus. This breaks and nicks host cell chromosomes that then get passed on to the baby. During the first trimester, the fetus is most likely to develop rubella-associated defects. During the first to second month, the fetus is 40 to 60% likely to be born with these defects. The third month is 30 to 35%, and the fourth month drops all the way down to 10%. The risk and severity of these birth defects may be associated with the immature host's defenses during the first trimester. Some symptoms of these birth defects include deafness, cataracts, intellectual disabilities, and skin rashes at birth. During the fetal infection, the virus multiplies and damages organ systems. The pathogenesis of these congenital defects due to rubella are not fully understood. However, it is believed that IgG antibodies in healthy individuals show some immunity to this rubella virus. Congenital rubella is diagnosed by virus isolation or serological testing. Women who receive the MMR vaccine should avoid pregnancy for at least 4 weeks. The MMR vaccine stands for measles, mumps, and rubella. It is an attenuated vaccine, and the vaccination programs began in 1969. These vaccinations are 97% effective, and people who should get vaccinated are between the ages of 12 months to 12 years old. There are 2 doses associated. The first dose should be given at 12 to 15 months, and the second dose should be given at 4 to 6 years. The treatment of the rubella virus has no specific medication. It is mostly comfort treatment and preventative medicine, which looks like the MMR vaccine. The rubella virus is best managed with bed rest and medications. Usually the rubella virus will resolve on its own terms.